Welcome to the new electronic reporting website for communicable diseases in Buncombe County. The first thing you will see when you open the site is the dashboard. Note the reminder in red. This site is for reporting communicable diseases by healthcare providers only. You will also see our 24-hour nurse line. It's 828-250-5109. Below that message, you will see two options for reporting. On the left side is the communicable disease report, and on the right side is the animal bite incident report. We'll go through the communicable disease report first. To get started, click on the blue button that says Report Communicable Disease. At the top of the page, you can read the North Carolina Administrative Code requirement. When you click on the section, it expands to give you more information. To see the time frames for each disease, click on the link in the sentence that reads, "The reportable disease timeframe can be accessed here." A PDF document will open in a separate window. You can now return to the reporting form. The top section also has a contact number for the state communicable disease branch epidemiologist on call. Now that the form is up, you can start filling out each section. Note that all the required sections and text boxes have a red asterisk and the word required. This means you cannot submit the form without completing these fields. Please enter the name of the medical practice. This information allows the health department to follow up if they have any further questions. Give the contact person, phone number, and fax number. If there is more than one provider, you can check the box at the bottom left to reveal additional fields so you can enter the information. Next, we will input the patient information. If the patient is a minor or someone who has a healthcare guardian, please complete this section as well. Next is the patient contact section. Please complete the required fields. In this section, it is important to determine what county the patient lives in, because communicable diseases are reported to the patient's county of residence. There is an option that will bypass all the required information. When this box is checked, the fields will no longer be required. Next, you will see the demographics section, with required field boxes for race and ethnicity. The patient association section is next. This alerts the health department to potential outbreaks in high-risk or congregate settings. The next section is for disease and condition information. The time frame you have for reporting is in the disease label for easy reference. This allows for prompt action by the health department to intervene as soon as possible for contacts and prophylaxis. For exposure locations, some choices will open other boxes to complete. For outcome, if the patient is hospitalized, complete the date box. The next section is treatment. Note that this section is only required if the reported disease is a sexually transmitted disease. This section is frequently missed and requires much follow-up. However, it may also be completed for other communicable disease treatments. If there is more than one medicine for treatment, there's an option to add another. The diagnostic testing section is important to complete because the health department can't investigate disease reports without lab confirmation. This only needs to be completed if you do not have a lab report to attach to the form, or if the reportable disease is one that doesn't require testing. In these instances, you can leave the section blank and attach your lab report and/or office notes. However, if you do have labs, the health department asks that you attach them. Note that at the bottom of this section, there's a link to report another lab test result for the same disease if needed. The comment section is right under the attached tab. There is also an option to add a second condition for the same patient. Simply click on this option as pictured above and add another disease. If this option is chosen, you will not be required to fill out any patient demographics. Once the form is completed, you will first check the box that says, "I am not a robot." Afterwards, click the Submit button. If there are incomplete fields, you will not be able to proceed. Instead, you will see an error message. Read the error message to determine which fields with the red asterisks need completion. Failure to click on the "I am not a robot" button will give you an error message like this one. Once you have successfully completed the form, there is an option to download a PDF for your records. There is also a blue button to start a new report for other diseases on other patients. Next, let's look at the bite report/incident report form. The process to report an animal bite or incident report is the same. Simply click on the blue button to get the incident report form. You will see the same options as the communicable disease reporting form, but the notice at the top of the page is different. Here you will see links to the statute that requires all animal bites to be reported to the local health director, as well as additional bite report resources that are available in the rabies manual. This includes animals that are owned and up to date on vaccines. Complete the form by filling out each section. Note that all the required fields have a red asterisk and the word required. This means you cannot submit the form without completing these fields. There is an option for a parent or guardian if the victim is a minor. It is very important to have the victim's address and location where the bite occurred. Enter the victim's address in the address field. Incidents like this may require cooperation with animal control in other counties. The TD/TDAP section is for the tetanus vaccine information. It is important to note that the CDC recommends a tetanus booster within the last 5 years with any animal bite of deep scratch. This screen shows that the tetanus vaccine was administered and the date. If you click No to this question, another box will open underneath. This is asking if the Tdap vaccination was done in the last 5 years. Next, you will see the post-exposure prophylaxis, or PEP section. This is when someone is sent for or receives a rabies immunoglobulin and rabies vaccination. There are spaces for you to document why someone was or was not referred for PEP. PEP is not required if the animal can be located and quarantined. The next section is the bite information section. In this section, you can note the location where the bite occurred. This is a good opportunity to remind all providers and healthcare staff that any animal bite is reportable to the health department. You must notify the health department of the bite even if the animal is owned. Please note that the health department has provided the contact information for Asheville Police Department Animal Control for incidents inside the city limits, and Buncombe County Sheriff's Department Animal Control for incidents outside the city limits. The animal information section follows. Below this section is an attachment section to attach pertinent medical records as necessary. The comment section is the final section. This is the place to document any other pertinent information that needs to be communicated to the health department. This includes noting where the bite occurred if it is different from the victim's address. Once the form is completed, you will first check the box that says, "I am not a robot." Afterwards, click the Submit button. Once the report is submitted, you will have the option to download a PDF copy for your records. If you have any questions, please feel free to reach out to our 24-hour communicable disease nurse line at 828-250-5109.